So hi, I'm Dr. Peter Bernstein. I am the director of the Division of Maternal Fetal Medicine here at Montefiore Medical Center and the Albert Einstein College of Medicine.
Hi, my name is Lisa Nathan. I am the medical director of the Labor and Delivery Unit at Weiler Hospital within the Montefiore Medical System.
The other big challenge we've had has been around, the reports of venous thromboembolism. Our internal medicine colleagues were routinely putting all of their patients who were recovering from COVID on thromboembolism prophylaxis. You want to talk about how we approach that?
Really over, I would say, the last 4 to 6 weeks or so. So the patients who were pregnant in March and in April in their third trimester, early third trimester, late second trimester, who are now delivering or are postpartum, we're seeing a number of them coming in with complications of VTE with some unusual presentations. We've had some with thromboses in the pelvic vasculature. We had one patient who had what we believe was a catastrophic APLS presentation with infarcts in her liver and severely IAGR fetus, likely with emboli to the placenta and the uterus as well. And so we also were having a suspicion based on a number of obstetric complications such as severe IGR, abruption cases, multiple IUFD cases, and knowing what the non-pregnant patients with COVID-19 were starting to present with as well, with this increased risk of VTE. We got in contact with some of our other New York City colleagues to see what everyone was doing with regards to anticoagulation, because it really seemed to be clear that there was this increased risk, especially for pregnant patients who at baseline without COVID-19 are already at increased risk for VTE. So we developed our own guidelines using some of the literature and the guidelines from our internal medicine colleagues and came up with a stratified protocol based on severity of the COVID-19 infection to put our patients on various amounts, doses, as well as for various lengths of time on anticoagulation. I mean, we know pregnancy confers an increased risk, 4 to 5-fold increased risk of VTE, especially in the postpartum period. And I think if you look at your patient and you add COVID-19 as an additional risk factor, if someone's also had a cesarean delivery, if they also have other risk factors, comorbidities, I think it may be a safe thing to just go ahead and put them on a prophylactic dose. You can do it just for 2 weeks or 4 weeks. I think at this point, when we still are learning so much, to err on the side of caution. I think a prophylactic dose, it does have some risks, but in the grand scheme, it's probably the safest thing to do.